Okay, goiter. Goiter because our diet, the diet of the patient does not have enough iodine in it. As a review, we know that the T3, T4, the thyroid hormone, they require iodine atom in order to make it. T3 requires 3 iodine atoms, T4 requires 4 iodine atoms in order to make this thyroid hormone. When we don't get enough iodine in our diet, then the thyroid gland cannot make enough of the thyroid hormone. Then if we do not get enough thyroid hormone, then the thyroid gland will be stimulated by TSH. TSH stands for thyroid stimulating hormone. TSH, thyroid stimulating hormone, is secreted by ANPIT, anterior pituitary. So when the thyroid gland is under constant stimulation of thyroid stimulating hormone from anterior pituitary, the thyroid gland will keep on growing, growing, growing. That's why in goiter, your neck becomes swells like a ball. Hyperthyroidism. Hyper meaning that we have a lot of thyroid hormone secreted. This is like the opposite of the goiter. When we have too much of the thyroid hormone, then it will cause Graves' disease, meaning that the antibody reacting to the antibody in our body, they works on the TSH receptor, mimicking the effect of TSH. Again, TSH receptor is on the thyroid gland. So in other words, some antibody, they will bind to the TSH receptor on the thyroid gland, and then to tell the thyroid to make more thyroid hormone, so that you have excess thyroid hormone. The symptom is the protruding of the eye, nervousness, hyperactivity, abnormal heart rhythm. All this because the person has too much thyroid, produces too much thyroid hormone. Probably because some of the antibody, they also binds to the TSH receptor on the thyroid gland. And then what about parathyroid? So if we have a parathyroid malfunction, it can cause something called hypoparathyroidism, meaning that hypoparathyroidism meaning that the blood calcium will drop. The blood calcium is too low. What will happen? When blood calcium is too low, then our muscle will contract. We induce, this is called a teptony, some kind of muscle contraction when we don't get enough calcium in the blood. And then adrenal gland. So if we have disorder in the adrenal gland, what will happen? We have this Addison disease. Addison disease, it is due to the, again, immune system, autoimmune malfunction. They secrete antibody to attack our own adrenal cortex. When our adrenal cortex is destroyed, what will happen? We don't get enough of the adrenaline, adrenal cortex. Adrenal cortex, meaning that we don't get enough of the mineralocorticoid and glucocorticoid. We don't get enough cortisol, and we don't get enough aldosterone. So adrenal cortex secrete two types of hormone. Remember, aldosterone and cortisol. Cortisol is a form of glucocorticoid. Aldosterone is a form of mineralocorticoid. So the symptom when we don't get enough cortisol is all this: weakness, weight loss, and bronzing of the skin. When we don't get enough mineralocorticoid, the aldosterone, it can affect the reabsorption of the sodium. And then when we don't get enough sodium into blood, we don't get enough water in our body, then it can affect the heart because it can affect the blood volume and blood pressure. Diabetes mellitus, let's see. Diabetes mellitus, okay, it is the major topics in endocrine system or in the digestive system. We have two types, type 1 and type 2. So it affects 8.3% of the population in here, in the United States. Type 1 is that they do not produce enough insulin, it is a genetic. Type 2, they cannot use the insulin, so they are not responsive to insulin. And when blood glucose increases, and then the glucose and water they lost in the urine, the cell, they cannot absorb glucose into the cytoplasm. And because they lost so much glucose and water in the urine, they go to pee frequently. It causes a thirstiness because they lose so much water, and increase in hunger because they lose a lot of glucose in the body, and the body cannot store up glucose. That's why they want to eat a lot. And we use something called glucose tolerance test, glucose tolerance test, to see if the person has diabetes. What we do is that we inject glucose into give glucose or inject glucose into the people's body. In a healthy individual, there will be increase in the glucose level, let's say in 1 hour, but then eventually it will decrease back because our body can produce and respond to the insulin. So the insulin will lower the glucose level after 1 hour, but for diabetic patient, it won't happen. It will keep on increasing the blood glucose level, and then eventually it will decrease a little bit, but it's still at a very high level of glucose. Because in type 1, the body does not produce enough insulin. Type 2, even though they have insulin, their body does not respond to it. Okay, let's take a look in the detail. Type 1 diabetes is insulin dependent. It can be due to some kind of environmental agent, virus, or autoimmune condition, so that your body does not make enough insulin. So there may be an immune system attack the pancreatic beta cell, and then a cell break down fat as energy because the reason why the cell has to break down fat as energy because the glucose cannot be absorbed into the cell. When glucose cannot be absorbed into the cell, then the body cell cannot use glucose for energy. That's why the body cell, they have to break down fat for energy. Then you have ketone build up. When you have too much ketone, then it's called ketoacidosis. When you have too much ketone, it will make your blood acidic. When your blood is too acidic, it will cause coma, and eventually it will make people die. Insulin, if we inject too much insulin, it will cause hypoglycemia. That means low blood glucose level. When we have too low blood glucose level, it can cause unconsciousness. That's why when people say, oh, I have low blood glucose level, usually when they are tired and drowsy, and if they eat something, it will help.